Welcome, everybody. This is David Nevins for CityBizList, and we're happy to have you today enjoying our program. Our guest is Ken Krieg. Ken is the CEO of Medical Optometry America, otherwise known as MOA. And Ken has been at the forefront of innovation and entrepreneurship in healthcare, and MOA is just the latest in a series of very successful healthcare ventures that both have and are changing the healthcare landscape in America. Ken, welcome to our program today.
Thank you, David. Happy to be here today.
So glad to have you. So MOA, or as I said, Medical Optometry America, is an emerging brand that is, I noted, already starting to transform, let's say, the eye care ecosystem. Tell us about the company and what drove you to start it.
The last 15 years, I've been the CEO of a company called PRN, Physician Recommended Nutraceuticals, operating in the optical space, in the eye space. And during my 15 years with PRN, which was a company that offered evidence-based nutraceuticals and supplements into the eye space for different disease conditions, we really had a chance to take a look at the way the ecosystem was set up for patients to get access to care for non-surgical eye disease issues. And what we saw was a very interesting situation, which really caused us to make the investment and make the decision to build the MOA company. So in the United States, we have about 15,000 ophthalmologists. And ophthalmologists practice surgery. This is a surgical profession. And at this point in America in 2022, we're closing in on about 5 million cataract surgeries a year. So the ophthalmology waiting rooms are filled with baby boomer patients who are in line now for their cataract surgery. But this creates a problem because these same ophthalmologists then don't have the bandwidth to take care of a wide array of non-surgical eye health issues: dry eye, glaucoma, macular degeneration, diabetic retinopathy, and so on. It would lead you to believe then that a lot of that traffic would wind up in optometry offices, but we didn't find that to be the case. So interestingly enough, optometry in America, primarily a vision correction specialty, although by license, the optometrist can do all of these non-surgical eye health disease issues, can work on these disease issues, but for the most part, they weren't. This is a function of training, predilection, the relative lucrative nature of optical America over the last so many years. But what we saw was a paradigm shift. So as the capture rate for being able to sell a patient glasses or contact lenses was coming down, the disruptive change from the Warby Parkers and the 1-800 contacts and other online distribution channels caused the optometrist to be concerned now about maintaining that margin and maintaining the revenue that they have been creating from the optical side. So it seemed to us the void here would be filled by optometrists that were willing now to play on the medical side. But the issue became that many of them were far removed from the training, the equipment, and the capability to fill that void. So MOA was set up specifically to find that middle space between optometry, historical optometry, which is basically a vision correction specialty, and ophthalmology, which is basically a surgical specialty. We needed to have a group that was willing to tackle millions and millions of patient visits that were currently having a hard time finding access or finding a home. And that really led to the creation of the first MOA Center in January of 2021, after about a year and a half worth of working on the issue and building the company.
So that was quite well put, Ken. I guess in simpler terms, would you agree that MOA has positioned itself between the eyeglass store and the ophthalmologist, and there's a big space there, correct?
Yeah, if you want to look at it in simple terms like that, we are getting referrals from all parts of the eye industry. So, ophthalmologists send us referrals because they're too busy to see a lot of these cases. And optometrists send us referrals because, quite frankly, they don't have the equipment that we have. And many of them have lost touch with a lot of the clinical side of how they were trained. So the model is very specific. It caters to basically a void in the market.
So I know I don't think people, I certainly wouldn't go to the corner eyeglass store for this, but I know that you are treating a number of patients that come in with, different conditions. What are some of those, and what are you seeing out there as you grow the business?
Right. The most ubiquitous disease in the world is actually dry eye. And in the United States, it's thought to be somewhere between 40 and 50 million Americans experience dry eye issues. About 7 or 8 million of those 40 or 50 million make their way to a doctor for treatment. It's a disease condition that can go anywhere from mild to intractable, and intractable dry eye is definitely life interrupting. So we do a lot of dry eye. And again, this is a disease issue that the ophthalmologists prefer not to deal with. It's time consuming from their point of view. It takes a good amount of time to work through, do the workup, and then make the proper recommendations or provide treatment for the problem. Another major issue in the United States is 25 million or so type 2 diabetics. And it's presumed to be another 80 million or so on the waiting list. So America is in a diabetic, huge problem with the diabetes questions in America. And type 2 diabetics need to have an annual eye exam. Last year, there were about 22, 23 million done in America. Now, the optometrists are perfectly capable of conducting that diabetic eye exam, but many of them don't do it. Many of the public don't know that optometrists can do it. And the referral nature of the marketplace generally is sending those patients to ophthalmology who don't want to spend the time. When you have a diabetic exam, there has to be a pretty intense report created that's sent back to the primary care physician. Many MDs, ophthalmologists, really don't have the time to do all that. So the MOA Center is perfectly capable, willing, and wants to do these type 2 diabetic exams, do all the reporting back to primary care. And as part of our overall eye physical that we create, we're able to identify other disease issues as well while that exam is occurring.